Hi, I'm Dr. Kosaki from Funk Physio. Today I'm going to talk about hamstrings injury, which is very common in sports activities. So many people return to sports with no rehabilitation after hamstrings injury. That's why people have repetitive and multiple injury. So hopefully you can take some information from this video, and I'm going to explain about why people get injury and how we progress the rehabilitation program. Muscle injuries usually happen when the muscles have to work in a stretched position. For example, hamstrings attach to the back of the pelvis at the hip joint level and also attach to the tibia at the knee joint level. So when you raise your knee up, that's gonna stretch your hamstrings, and also when you stretch your knee and kick your leg out, that also causes the hamstring stretching. When your hamstrings work in this position too much, or if your trunk control, pelvis, and hip control, knee controls are poor, you get injury, hamstrings injury. Sprinting is the common sports activities that people get injury, hamstrings injury. So when you sprint, your trunk is leaning forward, then that's gonna cause the hip flexion. Then before you land on the ground, your knee is extended, stretched. That's the position where people get hamstrings injury. After you land on the ground, you just push off. So those phases are not when hamstrings are injured. So this is when and how people get hamstrings injury. Now I'm going to talk about how and why people put too much stress on the hamstrings. Surprisingly, hamstrings strength and flexibility are not the risk factors for the hamstrings injury. Instead, our trunk function, pelvic position, or asymmetry are the causes that can influence on the stress on the hamstrings. So I'm going to talk about those factors. Okay, first, anteriorly or posterior pelvic tilt. So this bone is a pelvis, and it attached to the hip bone and back bone. So this bone actually tilt or rotate anterior and posterior, forward and backward. So this is anterior pelvic tilt and this is posterior pelvic tilt. So if you have anterior pelvic tilt, you see this part of the bone is moving upward this way. So this movement is going to cause stretching hamstrings. So people with anterior pelvic tilt have higher stress on the hamstrings. So if you have anterior pelvic tilt, then when you sprint, you have more tension in the hamstrings, then you get injury. With my pelvis, so you see the belt line, this angle should be 30 degrees of anterior pelvic tilt. If you go too far, this is called anterior pelvic tilt. And then if you go posteriorly, it looks like horizontal to the ground. That's called posterior pelvic tilt. So if you have too much anterior pelvic tilt or posterior pelvic tilt, then you have higher stress or less efficiency for the hamstrings movement, then you get hamstrings injury. Another cause of the injury is asymmetry. You may put more weight on the right side than the other, or you may have scoliosis or old previous injuries in your shoulder, neck, or even ankle. All those previous injuries might change the stress on the hamstrings. So you need to see a physical therapist and find what caused your hamstring injury, so you can prevent from another future injury. I'm gonna briefly talk about the rehabilitation program after hamstrings injury. So we usually break into three parts: acute, subacute, and remodeling, which is a sports rehabilitation phase. in acute phase, which is the first week of the injury, or maybe 3 or 5 days after the injury, the main purpose of the rehabilitation in acute phase is to walk without pain. To walk without pain, you need to decrease the pain, so you may do icing, which I talked in the other video, or you can do range of motion exercise gently, or isometric exercise. So gentle range of motion exercise means no stretching like this. You can do only hip motion or knee motion. So you can practice using a hip joint and lie on your back, then bend your knee like this. This is the example of the range of motion exercise. And then for isometric exercise, isometrics means your muscle length doesn't change during the exercise. So this exercise is good for 2 reasons. First, pain relief, and second, maintaining your muscle strength. So I'm going to show you one example of the isometric exercise. So I'm gonna okay, you will sit on the chair, then you put the foam roller like this under the chair. If you don't have foam roller, it's okay, you can just put the other leg as a resistance, but you're gonna place the leg on a foam roller, then you're gonna push into this way, so you're gonna activate the hamstrings muscle. Then you're gonna hold it for 30 seconds, but you can start with maybe 10 seconds, 20 seconds, then progress to the 30 seconds. If you can progress to 60 seconds and maybe 2 or 3 sets in a day. And then make sure you don't feel pain, but that's the first exercise that you can do after the injury. 1 or 2 weeks after the injury, which is subacute phase, you can start hamstring strengthening, stretching, and also you can do whole body assessment, and maybe you initiate the prevention program for the future injury. For whole body assessment, you have to ask physical therapists about your pelvic position or trunk function. So like I said, those function and position can influence on the stress on the hamstrings, so you have to ask them. For the stretching, you can just simply bend over like this and stretch your hamstrings, or you can lay on your back, put a strap on it, then raise your leg up like this and stretch your hamstrings. For the strengthening, you start with maybe leg curl, like put the resistance on it, then bend your knee. Or you can simply do squat or deadlift. Or you can, if you know the good morning exercise, you keep your knee straight, then like bend down and extend it, so you can strengthen your hamstrings. Make sure you don't feel pain. If you have pain, you can ask physical therapists and what to do, and also how to progress the exercise. For the prevention program, Nordic hamstrings exercise is really good exercise for the prevention. This is evidence-based, and this is very intense hamstrings exercise. So to do so, you're gonna make kneeling position, and you need a partner to stabilize your ankle, or you just need a table to stabilize the ankle. You're gonna make kneeling position, then partner stabilize the ankle, then the person who's doing the exercise going down, bend over slowly, very slowly to the ground. Then once you get to the floor, you can push up the floor, then go back. Gradually and slowly go down and push up like this. This is very intense and very hard exercise for the hamstrings. So you can start with 2 for each set, Maybe you do 5 sets of 2, then progress to 10 sets of 3. This is a very good exercise, and you can even do after you return to sports. Finally, once you recover the strength, flexibility, or any other postural impairment, you may go back to the field. You may do some agility exercises such as cutting, jumping, or sprinting depending on your sports. Make sure you don't feel any pain or symptoms. If you do, you likely have another injury. So make sure with your physical therapist or trainer, then your body is ready to go back to sports. Hopefully this information is interesting and helpful for your injury management. I just talked about hamstrings injury, but if you have any other parts of the injury such as quad, calf muscles, the principle is the same for those injury. So you can use that information as a reference. If you have any questions, concerns, please don't hesitate to reach out to us. We are happy to help you. Hopefully with that information you can improve the performance. So yeah, thank you for listening and see you guys.